Another important thing, because we brought up this issue of trisomy 18, is chromosomal anomalies. Well, certainly there were 7 out of the 105 chromosomal anomalies in our group. Now, that's of those patients that actually underwent a karyotype analysis, that was 24%. So that's quite a significant risk. But this was the important thing. Each of these fetuses demonstrated sonographic anomalies. In the 22 fetuses that had a normal karyotype, each fetus was morphologically normal by sonography. When we looked at diabetes, only 5 diabetic mothers were seen in the studied cohort, and each had an anomalous fetus. So diabetes in and of itself did not contribute a single fetus to the cohort of polyhydramniotic fetuses. We are also a center for referral of Rh-immunized pregnancies, and in our study cohort, there were no instances of Rh isoimmunization alone. If there was, we didn't have any cases of immune hydrops fetalis, but immune hydrops fetalis can be associated with polyhydramnios in the same way that non-immune hydrops fetalis can be associated with polyhydramnios. There were 4 macrosomic fetuses in the group, but none happened to be the offspring of a diabetic mother. So these are the conclusions that I have when I think about a case of polyhydramnios. The probability of an anomaly is directly proportional to the degree of polyhydramnios. So if I'm looking at a 16, 17, 18 centimeter deepest vertical pocket and I'm not seeing any abnormalities in the fetus, I'm sweating bullets. Diabetes and Rh isoimmunization are not significant contributors to our pregnancies with polyhydramnios. So in fact, if the requisition says diabetes or Rh isoimmunization, I'm not going to be lulled by that information. I'm going to redouble my efforts to check out the fetus to make sure I'm not missing an anomaly, and I am not simply going to ascribe polyhydramnios to either diabetes or Rh isoimmunization. The probability of a normal outcome is high when the fetus is sonographically normal. A karyotype abnormality is unlikely in the presence of a normal sonogram. Now, I would never dissuade a woman from getting an amnio despite the fact that the fetus appears normal. I'm just saying that in our experience, it is very, very, very unlikely to produce an abnormal result. Monochorionic and gastrointestinal anomalies are the most common categories of abnormalities producing polyhydramnios, and they also produce the most severe cases. My gold medalist with the 22 centimeter pocket had twin transfusion syndrome. The overall survival in our study cohort was only 58%, but it was 100% when the sonogram is normal. So, in my opinion, this is one of the greatest strengths of sonography. If the sonogram in a case of polyhydramnios is normal, it remarkably changes the prognosis for the pregnancy. This is extremely valuable. Thank you very much.